the topic for today is a second part of what we started last week, what is about cognitive health and wellness as we age. And so we went into some greater detail as far as what cognitive health or dementia, Alzheimer's is last week. So I just wanted to go over the basics again and the things that we talked about that we can do to, I'd like to say, prevent. And if we have any chance of preventing it, these are the things that we know of right now that help our brain health. People often get worried about their memory as they age, and is this normal? Is this Alzheimer's? Is it going to be scary? Is it like there's all kind of thoughts and feelings and potential fears that go along with it. So, my experience, the best thing that we can do is take steps to make sure our brain is as healthy as possible. And so those things, there's really six major things that we can do to prevent, stall off, make our brain health the best it can possibly be. So those are physical activity, moving, some, as in physical education for years, there's lots of different opinions about what that should look like and how many minutes a week and all that. We can get kind of lost in the details of how much we should do and what type of activity. But the bottom line is just move as much as you're able to. The more you move, the better. So, that could be look like go for a walk or lift weights or anything. Just walking around your apartment, walking from your chair to the bathroom, anything. Just move. Number 2, eat a healthy diet. And again, there's lots of information about what is a healthy diet. And I would just suggest that it's up to us to find out what works for our own bodies. One thing that is pretty similar across beliefs is lower sugar seems to really help us feel better. Third, get adequate sleep. Again, how much? That's going to be up to you. But you probably know, I feel better when I have maybe X amount of hours, or I've done a certain thing before bedtime. Just do what you know to do to get adequate sleep for yourself. That helps clear the brain, clear the day. It's like a trash dumpster when they take the trash out when we get some good rest. So it's really good for the brain. Number 4 is stay mentally active. And I just call this learn new things. It used to be said, to stay cognitively well, that you need to do Sudoku and crossword puzzles and brain games. And those are fine. But the biggest thing is to learn new things. So if you do Sudoku every day, that may not be, that you may need to do something different. Find something new, maybe a new hobby, maybe a new language, anything. Just mix it up and keep the new neural pathways in our brain by learning new things helps cognitive health. 5 is socialize. Although some people think, I like to be by myself, I'm fine by myself. Really what I've seen and what the studies show is when we have a network of people that care for us, we care for, and we're socializing, it improves our mental health and cognitive health. And 6, manage stress. We talked last week about the impact of post-traumatic stress disorder, PTSD, that people that have been diagnosed with PTSD are twice as likely to be diagnosed with Alzheimer's. So it shows like the work that we do on ourselves, the forgiveness, the therapy, the working through issues, the tools that we have really does make a difference in our cognitive health long term. So manage stress, meditate, spiritual exercises, breathing yoga, anything that decreases your stress. This is a name your own adventure. Choose anything. So those are the top 6. There's also some doctors will say take supplements, as like really good high quality fish oil, turmeric, things like that. Certainly check with your medical doctor or health practitioner about those, because everybody's different. There's not one size fits all, but those are basics. Even with turmeric, it was interesting. I've heard turmeric for so long, but it decreases inflammation, which is what a lot of these prevention methods are about, decreasing inflammation. So several years ago, I had some blood work done to check my allergies to different foods. And one thing they tested was turmeric. And turmeric for me was very high in the allergic, or it caused inflammation for me. So if I were just to go, buy some book and the doctor says, or the person says, go have turmeric, it actually would have been worse for me. So with all these things, just check them out for yourself and see what works, what's right for you. But right now, there's no cure that people know of. There's things that people find that work better for them. And, we've heard through our time together, different people share about, well, this worked for me, or I read this book. So there's lots of information out there. There's no pill that cures it that we know of. So the best thing to do is take it into your own hands, and it's really just good overall health choices. So again, it's stay physically active, move, healthy diet, adequate sleep, learn new things, socialize, and manage your stress. Or just pick one of those at a time. So I really just want to spend the rest of the time just open it up to us talking and connecting, sharing whatever you would like to, and that's on your heart. If you've got questions, comments, as a caveat, you go, what kind of questions can I ask? So as a care manager for over 20 years, most of my clients, I would say probably 95% of my clients had some type of dementia, usually Alzheimer's. So usually it's the adult child or the spouse would contact me when their person would get unsafe and like something happened to go like, look, we can't manage this anymore. And what's going on? We don't know what to do. We don't know how to plan for the future. And I've also worked as a director of a adult daycare program. So like 80 people with dementia a day would come for day programming to give their loved one a respite. Also directed a memory care program in an assisted living, so where people live there. So, as well as being a hospital discharge planner and a hospice social worker and private care manager and to people's homes. So I've got experience, but people on this call have experience too. So we could talk about whatever you like. And if you want to share, just raise your hand. Like Peggy. Hi, Peggy.
Hi, Cheryl. Hi, everybody. Cheryl, could you talk about how dementia or Alzheimer's is diagnosed? Like if I'm experiencing symptoms of, forgetfulness, etc., what would I do? Who would I go to?
That's a great question. So really, usually people go to two different type of doctors. Sometimes they'll go to their primary care doctor, or else they can go to a neurologist. There are things, it's not really officially diagnosable except for symptoms. You really don't know someone has Alzheimer's specifically until autopsy. But what they can do is rule out things. For example, if someone shows signs of maybe they're getting lost, maybe they're having trouble with language, they're making some bad decisions, things like this, you want to find out, first of all, if it's something that is reversible. Like sometimes it's a urinary tract infection. Sometimes it's a thyroid disorder. Sometimes it's vitamin B12. So there could be some things going on that could be reversible. So you present, the best thing to do is keep track of the symptoms that you're concerned about. Usually it's of your loved one, sometimes it's of yourself. And sometimes the person with a dementia or cognitive impairment, they're not aware that there's anything going on. Sometimes people are aware. So sometimes you'll say, hey, you seem a little bit not yourself lately, and the person that you're talking to might go, I have no idea what you're talking about, and literally they do not. And sometimes they'll go, yeah, I've noticed I've put things down and I don't remember how to, where they were again. So if you keep track of the symptoms and when they started, that will help the doctor help determine what type of dementia it is or cognitive impairment. For example, if it's vascular dementia, so dementia is the broad label for cognitive impairment, and then Alzheimer's was one type of dementia. Vascular dementia is another type of dementia. Vascular dementia happens when people have a stroke. So that looks like someone's just going along like normal, and then one day when they have the stroke, things get really bad. You're like, dang, what happened here? But sometimes that could be an infection also. Alzheimer's is usually slow onset, and it's just like progresses, so that when something happens, like someone ends up getting lost, can't find their way home, or starts making some interesting decisions, and the family starts going, oh, you know what, this has been going on for a couple years, it just wasn't that big of we didn't think it was a big deal, but there were red flags. So part of the diagnosing is really just looking at the symptoms. If you go to a neurologist, sometimes they will do an MRI of the brain. They sometimes will do a spinal tap of looking at like what is going on there, if there's any signs. But the tricky thing with that is sometimes, like upon autopsy, some people's brain have shrunk and it looks like that person would have been expressing dementia while they were alive, but they weren't. So then why is that? So if just one simple test is not exactly enough. There's also tests like a mini mental exam, or MMI, mini mental. Mini mental test is about 30 questions that's asked. You can even look that up online. And they have the 30 questions there. What day is it? What year is it? What season is it? Think of these 3 words, and you ask them again in a couple minutes, things like that. I've heard of presidents taking this test. Woman, camera, whatever, whatever the words were. I don't even remember. So that test can be helpful too, but if people are, maybe if they're highly intelligent, they can do really well on that test, but maybe they are putting aluminum foil in the microwave or cat food in the coffee maker. So the test score on certain tests don't really necessarily reflect their safety or where they're at, but that's everything. You just kind of put everything together. There's other tests that, but the mini mental is like a real basic one. And the problem with going to a primary care doctor is a lot of them don't really know how to diagnose, or they don't have enough time to ask all these questions, because it's not just black and white. It's not as easy as, let's take your temperature. Oh, you've got this. Let's take your blood pressure. Oh, you've got this. So it's a holistic view. It's ruling things out. It's looking at symptoms, and then, it's multidimensional. A lot of times, different colleges like UCI, UCLA, bigger colleges will have a memory care kind of department that people can go get testing also. So that's if they don't know of a neurologist or a geriatric neurologist, you can always check it like a university close by. That's what I've got for you.
Yeah, I just want to share an experience I had, because my next question would be, what if you go to a doctor with symptoms and you've had previous tests? Like for me, I've had EEGs that have been abnormal. What if you go to a doctor and they sort of dismiss what you're saying? And I'll give you an example. When I had the abnormal EEGs, and what started it was I was disoriented when I was driving. So I started seeing a neurologist, and I was also having the symptoms of, forgetting things, and, and this went on for a while. And at one point, I'd go back and I said, I'm still experiencing this. And, he would just sort of, I won't say brush it off, but just like pass it by. So if you have a doctor that does that, how would you handle that? What would you do?
Well, it's a great question, and I would say that this is not specific to dementia or cognitive health. It's just any condition that you have. That the best thing I found is that kind of to be our own scientist and pay attention to our symptoms, track them. Like if we start a new medication, track like when we started it, did we have any symptoms? Did it make it better, worse? Do we have any surgeries? Anything health related, like keep track of that in any tests you've had. And then, so if something starts happening, maybe you have symptoms of like, my memory is not as good, or I'm notice that I'm not handling my bills like I usually would, for example. They're stacking up. I've misplaced my keys a couple times. So you notice that if you go to the doctor, then honestly, I was gonna say, unfortunately, they're what do doctors have? They have, in my experience, they've got pills, they've got tests, they've got surgery in their toolbox. And my job is to give them as many pieces to the puzzle so they can help me put it together to come up with, I want my memory better. So tracking things, and if any doctor just blows you off or minimizes things, or if you get this feeling like they're just not really hearing me or they don't have the answer, I would trust them that that's not your doctor. That's not the doctor that's going to be able to help you with this, and find a different doctor. I've had so many times over the years of assisting people with different health conditions, and not necessarily specifically with dementia, but for example, I had a client in the hospital recently. It was like a 93-year-old woman who was living in assisted living. And she started getting really angry and kind of combative with the staff, and cussing and just not acting like herself. And then they finally had to have the paramedics come and take her to the hospital. Well, the on-call doctor, so that's who you get. You won't get your regular doctor when you go to the hospital. You get who's ever there. That doctor said she was delirious and that she had a mental break, and that he was suggesting that she needed to go to a geriatric psychiatric locked unit to get looked at and checked out and on medicine. And so the family calls me and they're like, this was like drastically, like she's doing fine. All of a sudden she's not fine. And the doctor wants to send her not back to assisted living, but to a geropsych unit, and then put her on some antipsychotics that she would be on forever. And like, he's really thinking this is a mental break. Well, I went down there and we got a different psychiatrist that happened to be on rotation that morning when I was down there. And we ended up going into the woman's room, and she was awesome. She was just hysterical. She was a character, and she was a spicy older woman. But what we realized when talking to the psychiatrist, because I don't, as just a person, I'm not a medical doctor, but I'm a good researcher and I've seen a lot of things, and I'm tenacious. And I think that's what we need to be, is tenacious for our own health or our loved one's health. So talking to the psychiatrist, and she said, this woman just has delirium because she had a urinary tract infection, and the urinary tract infection is not cleared yet. And so what you're seeing here is just the end of the UTI. But she's retaining urine now because of the antipsychotic medication this doctor in the hospital put her on, because he's thinking it's psychological. She's retaining water as a side effect from that medication. She's retaining urine. And so the urinary tract infection is not clearing yet. So she said, just, she needs to drink a lot of water, clear this urinary tract infection, give it a few more days. She had been on some antibiotics for the infection, and now it's just clearing from her body. But really, she needs to get home in a familiar area so she feels better. And it's familiar, and this will clear. So we went from, like, during my visit, we went from she's going to a psych hospital to she's going back home. Drastic. I mean, family was flying in from out of town thinking she's either going to die or something's happening. Like, this was really off. All because we didn't take that first doctor's opinion as, it's not really the truth, but we didn't feel that was what was really going on. So we kept digging. And that's what a lot of times that's just what we need to do, is just keep digging, put all the pieces that you can think of together, sometimes it's getting a consultation with someone, or another professional, maybe it's another doctor or care manager. But I would just I never give up, and just to find out what's going on. That said, then there's a balance of that. If I'm working with another person, I ask myself, what is mine to do here? Do I keep digging, or does this person need to experience all of this? I don't necessarily know the answer for them, but I just know the answer for me. So if it's my health, I'll dig as far as I can, and then I'm clear, like, this is mine to do for me. If I'm helping another person, I ask myself, what is mine to do for them, versus just going in and trying to research things to make them better, but maybe theirs is not to get better yet. Maybe they have another lesson or something to learn about the situation. So does that answer your question?
Yeah, thank you so much.
Okay, sure. And I know you're very tenacious and good researcher. John. Hi. John and Lori.
Hi. I just love Cheryl, our Winston Churchill of Alzheimer's, never, never, never give up.
Yes,
never. I mean, Cheryl has helped us so much. Cheryl came out when we were in Fontana, baking in our camper, brought us a beach umbrella, brought us all these devices that, would prevent the great debacle of 2019, which was, of course, a great blessing as well. Like things, little people call it a CVS door alarm, that goes ding dong when somebody walks out the door, even if you're sound asleep. So I sleep with that thing right next to my head. I mean, it was sure a lot easier than what I had done before, which was like putting my sleeping bag in front of the door and sleeping there. So I just and Peggy, what you were sharing, is like, or and asking about. I mean, we just we it reminds me of, like, like telephone overseas telephone call centers, or even onshore ones, where you call that person and you can argue with them for a half hour, but sometimes I get smart and I just go, "Thank you so much for your help. Have a wonderful afternoon," and hang up. And then I call immediately back to get somebody else. And it's like that with doctors, right? Which I think is what Cheryl was saying. Not
Yeah.
your doctor.
Yeah.
I mean, I'll
Right.
just say right off, Lori's doctor her general was Dr. Wells. This is UCLA. And she was a woman of color who was just great. She did the little quick whatever it is, asked a few questions. It said, yeah. So, and the diagnosis they give, it's called dementia probable Alzheimer's. Like Cheryl said, until they cut your head open, they don't really know for sure, you know.
Mhm.
And I mean, even imaging is imperfect, right? So, and ultimately we come to, who cares anyway? It's like we're living in grace, literally. Thank you, JR. It's all being used, and it is all truly perfect. I know that sounds like a cliche, but it's like it is. And thank God, I mean, thank God for each of this journey. I mean, our journey started probably in 2008. We weren't living together. They had divorced me because I was a knucklehead. And it and JR had warned me like 2 or 3 times, you're not going to like what happens. Um, you know, be better, in so many different ways. And, I was a slow learner, like, that sign, slow children at play. And I was a slow children. And I, but JR hung in with me and through the whole. So here we are, like, living apart in 2008, and Lori asked me if I'd help her with her taxes. Well, that, in retrospect, that was like when, because she always paid all her bills and did all that when we were together, And by 2013, we were back together again, maybe thanks to the Alzheimer's, whatever it was. Like we just, I started getting my act together, getting my health together, not being sick all the time. I mean, Gene Caprillion at Now Production said, "Hey, what happened to the guy that beat the national indoor mile champion and snowshoed by himself across the Sierras?" And I didn't have an answer. I was like, yeah, what happened to that guy? As I was dragging my butt back into Now Productions after being sick for however long. And I just, like, I started doing things to take responsibility for my health, and I got better. And Makeda came to me one day, our daughter, and said, "Daddy, Mommy wants you to make juice for her." So that was like kind of the change. So I'll resist the temptation to go on and on as much anyway. But it's just like that shift. And so everything became an opportunity. It became an opportunity to heal my family, to heal me, to heal all of us, and it brought us together. It did so many things. And so I'm really thankful. Dr. Wells was her primary care. Dr. Buxton at UCLA was her neurologist. They definitely never brushed us off or gave us the runaround. It was just like, yeah, you know, and the benchmark test, at least in 2015 when we had it done, is called neuropsych testing. And that's like the 4-hour test. Okay. And they just go through everything. And we did that not because Lori wanted to or liked it, but because that's what we needed in order to qualify for SSDI, Social Security Disability, that you pay into with every paycheck, right? So it's like you get your Social Security early. And that was, yeah, and then you get total and permanent disability. But I mean, nobody obviously on this call is there, right? But I'm just saying it's like, it starts with just simple things. And here we are in 2024, living a beautiful life. There's progression still, but it's not bad. Don't you like that word progression rather than degeneration? It's progression. and we're just progressing along. But I still have a fully cognizant person sitting next to me who knows my name, and I'm very thankful, you know? And that's the thing, like whatever it is, it's really okay. Cheryl really helped us with that, of feeling okay about stuff. You know, she said, well, they don't want to take a shower. And that was like, oh my God. So I'm not being a horrible caregiver because I can't force them to have water sprayed on them that they don't like, you know? So I think it's like we just forgive ourselves. We can't do anything wrong because JR is managing it all.
Mhm.
And I I'm just really grateful.
I think you said you're grateful, but we're losing your internet.
And
I think we've lost you, John. Let's see if he comes back on. So I'll tell you a quick story. So I ran into a friend of mine, who actually I helped her with her mother, moving her into memory care. And it was actually when I was working in the memory care, and her mother moved in, and so I helped her. So until her passing, and then I haven't seen her for a while, and she told me, but she did tell me about 6 months ago that her sister now has um, some dementia that they're worried about. She's still living at home. And the sister was, um, what? It's funny. The word that I'm coming up with is not the right word, but she was not getting along well, we'll say, with her sister for a little while. And she didn't want to talk to her. The sister didn't want to talk to my friend. But then they made up and everything was fine. Um, and so I ran into her in the store. I didn't run into her, but I saw her at the store yesterday, and I hadn't seen her for a while. So I said, hey, how are things going with your sister? And she's like, she's doing okay, but she keeps getting worse. And I worry about her every day, he said. Now her sister's son is stepped up to take care of her, but doesn't talk. The son doesn't get along well with my friend, so she doesn't know a lot about the situation. Is not going there to help, right? So, but she worries about her every day, she said, and I really felt the weight of that when she told me that. And so, what I was sharing with her is that, for people who care, who are capable, and who are caring, and she could, I mean, she actually works with older people herself. And she could go and help and do something for her sister. She could, but she's not, and she feels kind of forced into that situation because of this, her sister's son. And so when I suggested that this is her sister's journey to walk, and her sister has her own life, her own karma, her own lessons in this. And as long as someone has capacity, or the person's like agent or power of attorney, person who's helping them, are involved, then they can make any choice they want, even if it looks bad to you and me. So I that's a common theme with people I talk to, that they feel like it's the people that choose to talk to me about it, because those are the people that may, there's some people that are on the front lines. There's some needs, caregiving needs, they're there. Other people are just out of sight. They can't handle it, or they don't want to. Some people will send money. Some people will do phone calls. Every person in a family system has their own role. But the people that could be like, I'm going to be there, sometimes those caregivers feel over responsible, and they feel this burden, like it weighs on them, like I should be doing more, but I'm not. So it's amazing the relief, like with a 5-minute conversation with her, and this has happened time and time again, with just reminding them that this person has their own life, their own lessons, their own journey, and it's not, you kind of wait to like go, what is mine to do for them? If there's something that you're called to do, go do that. But it doesn't have to be that you have to, like, there's some rule. A good person does blank, fill in the blank and find out what our rules are about that. Anyway, so she wrote me afterwards to thank me. I asked her what she learned. Let's see, I'll share that with you, since no one has their hand up yet. Let's see. Okay. So she said, I learned from our talk to stay away from negative people. Do not get involved in their business. Her son is very negative. And her sister's been negative at times. I cannot change family who see problems and not solutions. You advise to let go because we each build our own bubble or group. I left feeling that everyone has their way of existing and I don't have to join in. So especially with, something that like dementia that can, people can have it, for years and years and years. So if there's a caregiver that's just constantly holding that, or even after someone passes away, caregivers can hold that, like, I should have done more, I could have done more, but just knowing that, just giving them the dignity of their own life, and trusting that God, the universe, has got them and is taking good care of them. So if that helps anybody. Hey, John, I see you're back. Do you want to put a bow on that, or are you good? I heard you were grateful at the end. But now oh, there we go. I can hear you now.
Yeah. Just thankful and grateful. And as I was just extending the invitation if anyone wants to chat, and we're just happy to share our experience, not as any statement of authority, just as like, hey, this has been our experience. And mostly what I have to say is, don't worry, be happy. It's all good. You're going to God. You are God.
Mm-hmm. It is a lot about our attitude. Some things we don't have a choice about, how it affects our bodies as we get older, whatever that ailment might be, or what situation or whatever, but how we respond to it, and what meaning we give it, and our perspective all matters. Anybody else have anything you want to share with our friends here? You want to share, Carol? I see your finger there. I don't know if you're turning on mute or talk.
Yeah, can you hear me? I'm having
I
trouble
can.
with when I'm on my phone. Can you hear
Okay.
me?
Yes, I can see you and hear you. Perfect.
I'm speaking to you from Baja California. We've had no power for 30 hours now, and
Wow.
because of the storm. So I'm having to use my phone. But the conversation has been fascinating to me. I really, not only am I interested from my own health, but also I live with a man who's my husband, who's 84 years old, and I'm interested to see, he's really working on his brain. He's taking a brain course, and he does all of the things that you've suggested, all 6 of them. But what I'm finding is that as he's aging, I mean, he's always had a very bad memory, and he's working on ways to work with that. And deal with it. But my concern is he's become much more stubborn. And in this situation, we're dealing with a leaking roof, and with all the rain that we've just had, I had to wait until he chose the roofer that he wanted, and I arranged for 5 roofers before this one. and of course the roofer that he finally chose, and is not really competent. So my situation is, do you have any suggestions when you're living with someone who shows signs of aging, and in this case has become much more stubborn, how to handle that? When he's that way, that it doesn't affect me, I'm not concerned. But when it affects me, like I'm dealing with a leaking roof and putting towels out and trying to figure out what to do, I just keep putting it in the light. I keep putting the roofer in the light, and but I'm looking for other suggestions. If you have any, toward how do you deal with someone who, as they're aging, these character issues become much more pronounced. But in this case, stubbornness.
Mm-hmm. That's a great question. So light to your roof and your roofer, for sure. You know, I think I see a lot of older people get a little bit more set in their ways. You know, I even say with myself, I think it's more like I know now what I like and what I don't like, and so I kind of go with that more. But there is a certain thing that happens, I think, with people when their memory or their cognitive health isn't as good as it used to be. I look at it as that tasks have many steps, that when our brain is healthy, we don't really think about it. We don't think about how many steps it takes just to take a shower. But if you break down every step, it can be very overwhelming.
Mm-hmm.
Take your clothes off. Wah! Turn the water on, adjust the temperature, step in, water, the feeling of water on you. What do you do when you get in there? Oh, you got to use soap. You got to remember what soap is for. Shampoo. You got to rinse that off. You got to adjust the shower. You got to adjust the temperature. Rinse all that stuff off. Remember to put a towel there. Reach for the towel. Then get this stuff off your body called water. Get out, put your clothes back on. Like, even, you know, as people progress with dementia, they don't even, just even putting clothes on is super hard, right? They put them on backwards. They put a shirt on their legs. So you can see each of those steps takes a lot. So something like getting a new roof, getting the bids, hiring the right person, those all take a lot of steps, a lot of thinking. You know, if he was in the role in the family, like, I'm the one who decides on the best contractor, and I'm the one who decides which account we should pull the money for to pay for that contractor because of the investments. And if this one has been high, this one has been low, you know, all the steps that are considered there. And then, you know, it's important to me to know that I'm taking care of my family. My family needs a dry roof, so I'm responsible for that. But then all those steps get overwhelming. They may want to put the brakes on, but my guess is that there's a lot of anxiety, performance, also, you know, all those things you can imagine. So there is an area, I will say, like in the gray area, can be the most challenging with someone with dementia, like that they can still do quite a lot, but something's not as well, or something's like this situation with the roof. It's like, wow, this is super challenging, because he knows enough to be involved, but not enough to just not even know there's a leak. Because then if he just didn't know there was a leak, you could do it. But you are needing to engage him in a way that shows respect, that keeps him involved in ways that he's used to, and that, you know, used to be important to him, and that still are. And you negotiate all that. So it could look like stubbornness, but if he's having trouble with his cognitive health and impairment. My guess is that the steps and just the brain power executive function that it needs is part of that issue. So then knowing that, you can have more compassion, and you can get a higher view to go, oh, that's what's going on. It's not just this one thing. So during this time, I'll call this gray area, sometimes you have to be really creative with, doing like a plan B. You may have to be talking to people that in ways, it's not really necessarily behind his back, but you might have to do some things that he's not completely aware of. So that the roof is going to get handled, or have that difficult conversation with that person, that contractor, like, look, this is not appropriate. But a difficult conversation with a contractor might be too much for him to handle right now. That may be very uncomfortable. So you might have to have that conversation on the phone or in person when your husband's not right there. So it's sort of like, see how much he can handle, and keep learning about how cognitive health and dementia, whatever he might have, impacts how he might be thinking. So you can put yourself in his shoes, and then you can go, okay, I want him to be really involved, but maybe he just needs 2 choices right now, not 5 choices. Like when I interview people, yes, I'm interviewing 3, 5 people, however many, because I want the information, but that's way too much. So you get 2 choices that you like, both of those choices, and then you can go to him. Or maybe you've already made the choice, but you say, what is the choice? So you find ways he can have his dignity and his pride while you're really starting to take care of more of the business. That's what I've got for you.
Thank you. Excellent. Thank you. Excellent
Okay.
suggestion. Thank you.
Okay, hope that helps. I think John's got something to add here. And Peggy.
Yeah, Carol, I deal with what you're dealing with daily. It's usually like over the bathroom, and like I would like, if somebody was like acting in a way that was hard to be with, my response used to be, well, just walk away from it, but you can imagine what happens if you walk away from that task. It's like, then you're going to you have a new task called cleanup. So there is no escape in my situation. It's like, I've got to find a creative way to deal. And sometimes somebody can be totally sweet one moment and very irascible the next. And it's like the 2 choices are, let's see, Senor Ramirez, the roofer, can come on Monday or Tuesday. Which do you like better? So it's like, you have to be totally sneaky at times, but while at the same time being totally transparent, which is an interesting dance.
Mm-hmm.
But like, in other words, like, it's not like you're hiding something. If they see you doing it, you just have a smile and an answer. There's no wrong way. And say, you people are too serious. You need to be having more fun. That's not a direct quote, but that was the message I got. Like Jared would say, like, if it's not fun, I don't want to do it. So have fun with it, and like, have fun being sneaky. We just call it, like Cheryl did, creativity, because you're just the high self. It's so funny because sometimes while I'm being sneaky and speaking to somebody sideways while the person's always right next to me, and I'm speaking to a third person sideways, like the high self of Lori will say, yep, yep, yep. Like they know exactly what's going on. While the basic self has been given this little carrot, like, here, munch on this for a while. So it's a multi-dimensional experience, and it can be a lot of fun. Anyway, if you want more specifics, like I said, I deal with this daily, and I've gotten better at not freaking out.
Thanks, John. One thing you reminded me of is, so our daughter, I would consider her stubborn when she was a baby even. I could never just say, it's time to go take a bath. She would say no. And I couldn't, like, there was nothing I could do it was clear right away, like that's like pushing her is not going to work. Just didn't even phase her. So I came up with, I'd give her two choices. Both the choices work for me. So I'd say, do you want to take a bath now or in 5 minutes? She always chose the 5 minutes, but she would always cooperate because she had a choice. That's the same thing is true for her today. But if I kept wanting my way, just one choice, we would have had a very different relationship. So anyway, sometimes two choices, whatever works for you. And yes, being creative. And my thing, sometimes it's called therapeutic lie with someone with dementia. And I think as long as it's in with its integrity and it's for the person, sometimes you got to, make things up because the intention is right or the intention is clear, right? You don't want to be creating more things. But sometimes you just gotta be creative with how you approach it. Peggy wanted to share something.
Yeah, I just wanted to thank you all for your sharing. And Carol, I just want, or anyone else, there is a woman who has a fabulous website. And Cheryl, you may know of this. It's called Dementia Care Blazers. I don't know if you know of this. And it's a woman who's worked with people who are caregivers, whether that's family or, an independent caregiver, who've worked solely with people with dementia. And she addresses a lot of the how to handle difficult situations with the approach that John and speaking, John and Cheryl are recommending. So do you have a pen and paper? Because I can give you that information. Okay. There's two ways you can see her. One is on YouTube. And so you would just type in Dementia Care Blazers, and that will come right up. Or the website is dementiacareblazers.com. Excellent information from my point of view, especially handling tricky situations. That's all.
Thanks, Peggy. I'll give you a couple more resources for physical needs and physical caregiving. There's a woman named Teepa Snow, Teepa Snow, and she's done some amazing work, like teaching caregivers how to approach people with dementia. There's also the Alzheimer's Association in the States. I'm sure there's probably a phone number that you can use down there, but they also have some of the Alzheimer's associations have a 24-hour helpline that you can call in and go, hey, I am dealing with this difficult situation and I don't know what to do. And there's people on the call that can help you 24/7. That's the Alzheimer's Association. Anybody else before we close for today? All right, friends. Thank you so much for joining and for sharing and everything. Love you so much. And hopefully we'll see you again. All right. Bye, everybody.
Thanks, Cheryl.
Carol.